For everyone that doesn't know me, my name's Courtney. Thanks for joining us for today's webinar. Today, we're going to be going over some of the kind of key concepts of dipping your toes into digital for the first time, or I know that some of you are already using digital tools, so how you can build on top of that to further extend your offering. We'll be touching on your online presence, the importance of patient engagement for your current and your potential clients as well, and then also modernising processes that have typically been paper-based in the past, so things like online forms, bookings, video consultations, client records, and also the secure transfer of information. As I said, if you do have any questions, let's type them in the chat box and I'll either get to them as we go, or if we have time at the end, I'll answer them then. Otherwise, if I don't get to them today, we'll answer them when we send around the webinar link to view. So a quick background on us. There's a few people here that are existing Global Health customers. So you guys already know a bit about us, but there's some people who are brand new. So firstly, I wanted to touch on Global Health as a company and then HotHealth as a product. So Global Health has been around in the Australian healthcare software industry for over 30 years now. We started in Perth and now the head office is in Melbourne in Burke Street. I'm actually based in Queensland, so we do have staff scattered around Australia, but most of the core team are working in Melbourne at the moment. A few people are working from home as well with COVID, so we can be in the office as well. We work with a really varied group of businesses. So we, as a company, work with government level organisations, area healths, PHNs, all the way down to solo private practice specialists or allied health. So people that are just starting out in private practice that have previously come from other services, or mid-sized GP clinics. We kind of work in a variety of different spaces. And that's because we have quite a few different products. So you might have heard about Mastercare or Mastercare Plus, which are our clinical systems. We also have Primary Clinic, which is our clinical system for GPs and specialists. Then Global Health has ReferralNet, which is one of the 4 secure message delivery services in Australia. It integrates with most of the practice management and clinical systems out there, and it's also interoperable with Argus. And then finally, LifeCard is the personal health record app for consumers. So you'll actually see a little bit of LifeCard throughout your travels with HotHealth because the 2 logins are linked. So it kind of helps to complete the healthcare journey for the consumer or the patient. So from your HotHealth engagement site, they can easily jump to their LifeCard record. And quickly, just a bit about me. As I said, my name's Courtney. I'm the product manager here at Global Health for our consumer engagement products. I've been at Global Health for about 3.5 years now, and I have a marketing background. So for me, this concept of digital tools and engagement is really important because it allows you to extend your offering to your existing clients and also to new clients as well. So firstly, online presence. It's really important to have an online presence. Everything from your website, social media pages, Google My Business, all of the different touch points where a consumer might see you online. And it's really important to be consistent across all of those. So consistent from when they go to your clinic to when they see you online. It's the same look and feel throughout everything. And that consistent branding across everything really encourages brand loyalty, and encourages customers to come back repeatedly, and also allows a good level of awareness for any new customers. So if they see you on a few different online platforms and then they walk past your shop, they know that you're the same business. So I'm just going to show you a couple of different examples of how HotHealth can be set up. So you can see here the logo and the colors and the images are all branded to the organization that the HotHealth site is for. So As I flick between them, you can see the different colors. There's different announcements bars if needed. You can see here, this one's only got 4 links across the top, whereas, when I flick back to this one, there's more features enabled within the back end. So it can be customized to whatever you need it to be from a business perspective. The same on the mobile app, you can customize how the app page looks within the HotHealth app. So off the back of online presence comes community and patient engagement. So being online allows you to engage with your clients and your patients. It's always been really important to engage with customers. So if we look, back through the history books, you used to put up posters in your clinic. You used to maybe hand out notices at the end of an appointment, or a newsletter you used to send via post. Now all of that has moved online because clients want to be able to access them online in their own time when it suits them. So in HotHealth, we have a few different tools that enable that kind of communication style. So we've got things like events where you can create events. They can be, regular occurrences. So I can say this is going to happen every week. I can choose for a reminder to be sent to participants. So I want to send it 1 day before. You can put in addresses so that people can easily get there from your site. You can add any additional details, any images. And then this next part, whether it's viewable by public or by groups. So HotHealth has this concept of group engagement where you can invite users to your site. So let's say your current customer base, you invite them to be part of your site, and then you can group them into similar types of businesses. So it might be age-based, it might be condition-based, it might be services-based, depending on your business. It might also be that you offer a paid service and you create a group for paying clients, and then they get access to different events and news pieces on your site because they've paid to have access to them. So I can say, okay, I want this event only to be accessible to this group here. I'm going to ask for RSVP responses, and I'm going to limit that number to 10 because at the moment during COVID time, that's all you can have in an outdoor activity. And then I can choose to send a notification to those people I've just invited. And that will be via email or via push notification on the mobile if they've got the HotHealth mobile app downloaded. So that's the events part. The other part where you can use that group functionality is news. So in here, you can see I've put in a news article here, and I've also made it accessible to that group of people. And then the final part you can use groups is in the chat settings. So I can either choose to have a chat with a person, or I can choose to have a chat with a group of people. In the chat, you can have a normal conversation, and you can also attach different things as well. So that's some of the patient engagement features we have on HotHealth. If I flick back to the presentation, we'll go over digital forms. So digital forms is really exciting for me because it's one of our newest features. And I think it has a really big opportunity to make your processes more efficient from a business perspective, but also to give your patients a better experience. So why are digital forms important? So they save administration time. They reduce rekeying errors because the submissions have been typed, they're not handwritten. It's better patient service. It's easy for them. They can access the form on any device. They can access it from home. They can access it when they walk in the door to your clinic. And in the long term, it will allow you to pull out insights because you can, export the results as a CSV file if you were doing patient satisfaction type surveys, and then you can track trends over time. So HotHealth forms, they don't have to be clinical forms. They can be anything from patient registration. They can be patient satisfaction, newsletter sign up, event registration. They can be for clinician to a clinician as well. So they might be referral forms. They could be prescription reorder forms. It's really customizable because the back end is all drag and drop. It's also URL based, so you can use those links to those forms in other form of communication pieces that you do. So SMS, it could be email marketing. It could even be that you have a QR code that's linked to that URL as you walk in the door of the clinic. And then anyone that hasn't done their form online before they get there can just do it on their phone while they're in the waiting room. So it opens the door to a lot of different ways of having patients fill out the form. And the last thing that's cool about HotHealth Forms is that it's integrated with ReferralNet secure messaging. So it means that when a clinical type form, such as a patient registration form or a screening form, is filled out, you can choose for that form to be sent directly via ReferralNet to your practice management or clinical system. So I'll just jump into the back end and show you forms here. So this is a form as if a patient sees it. So they would fill out this. As I said, it's mobile responsive as well. So this can be filled out on whatever device they're on. And they don't have to be logged into HotHealth to fill out this form either. So if I just fill out some of the key bits, you can have free text fields, date selectors, radio buttons, and then you can also put in conditions. So if this question is answered yes or no, sorry, then ask a follow-up question. So you can get quite technical with how the form runs. You can add in some consent tick boxes, and then they can actually digitally sign it as well. So that's from the patient or the end user's point of view, I guess, how it would work. From your manager dashboard, the first thing you need to do is jump into organization details. And in here is where you can select your recipient ID for secure messaging. So that might be a ReferralNet ID, or it could be Argus as well, because ReferralNet, which HotHealth uses, is interoperable with Argus. It does have a lookup as well. So based on the organization name, it will suggest some of the endpoints you can send it to. Otherwise, you can find your ReferralNet recipient ID from ReferralNet as well. To access the forms part in the dashboard, so this is the back end where you can edit what sections are visible. You can edit, your appointment default times with appointment booking, and also how your website looks. But from a forms perspective, we can see here all the different forms I have set up. If I open up one here, you can see this one's a multi-page form. So if I go to edit form, I can choose whether this one's sent to ReferralNet. And then here is where you can build the form out. So we've provided some templates, and those templates will continue to build in terms of the library. But if you did want to create one from scratch or edit it, you can just drag and drop different bits into here. You can change what it's called. For something like this, you can have different options. And then you can also choose whether it's required or not. So it's quite flexible in the way you want to set up the forms. You can also add in rules. So you could add them like if field name allergies equals peanuts, then send a notification email. Or in the case of COVID-19, it might be if the field name has been overseas in the last 14 days, has a value of yes, then notify a certain email address, so that there's another level of triggers and notifications that go out In terms of viewing completed forms, so here, as I said, they'll either be sent to via secure message to your end system, or you can export the responses as CSV. Otherwise, you can also just view them within the platform via web browser or PDF. And on here as well, you can see if the HotHealth user was logged in, what user that was, when the form completion was last viewed, and who it was last viewed by. So there's a bit of a audit trail in there as well. So that's how the online form part works in HotHealth, which leads me to online bookings. So online bookings isn't a new concept. It's been around for a long time. Everyone knows that it's convenient. It allows for your organisation to take more bookings when reception is closed or busy, and ultimately it frees up time for your reception staff to do other things. We know that for some people, they don't want to enable patients to book online. So HotHealth has the feature to turn off the ability to book online, but to still enable people to reschedule their appointment if need be. It also has automatic reminders built in, so email reminders as the appointment is coming up, and the appointments can be saved directly to the device calendar for ease of use. If the patient or the client or even the doctor logs in to the HotHealth site via their login, they can see a list of their upcoming appointments and reschedule or cancel them if they need to. And as a business, you can put in rules around how far out from the appointment people can cancel or reschedule those appointments from. And likewise, you can actually book video conferences in the same way. So before I show you how the booking part works, I'll just go through the video conferencing part of HotHealth as well. So why video consultations? They're safe, they're easy, they're great for follow-up appointments or after hours, and it also allows businesses to expand their reach beyond just their geographical area. So rural or different cities, if you are specialising in something, there's no reason that those services couldn't be offered in another geographical location. So HotHealth video conferencing capability meets all Australian telehealth standards. HotHealth itself is hosted in Australia, and the technology is encrypted in terms of the telehealth consult and also that forms data we were just looking at as well. And with the referral net integration, even the transfer of data out of the system, so from the form to another system, is all secure as well. So if I jump in back to one of our HotHealth sites here, I'm going to book a video consultation. So on the left here, as a patient, I can choose what type of appointment I'm booking, what practitioner I want to see, if it's in a specific location, if I'm booking in person. And then I can also filter by speciality or services as well. So there's quite a few different options there that you can configure. So here you can select whether you've seen them before, and again, you can add rules around, this doctor won't see new patients. And once that booking's been confirmed, the patient or the end user can add that to their device calendar. They can reschedule it, cancel it, or they can see a list of upcoming appointments in their calendar here. So I can see one today at 1:05. If I click on that, this is the appointment details page. So I won't show you the actual video consult today because we're actually in the middle of enhancing the platform to have new features for the video consult. So I'll do that at a later date. But the way it would work is the invited parties would go to their appointment details page, or they would click on a URL link in the email reminder they receive. And in this spot here, a join meeting button would appear, and they click on that to attend the meeting. So the new enhancements in the platform that will allow for group bookings. So it might be one provider, 2 patients. It might be 1 patient, 2 providers, so a GP and a psychologist. And it might also just be group sessions. So where we have a lot of clients in the mental health service space, and often they might have a couple of clinicians with a group of, 5 clients or something. And the new enhancements will allow that to happen online like they would in person. We are also going to have screen sharing in there, chat functionality, and also a whiteboard as well. So a really interactive session can occur online. At the moment, if you were to have a video conference today on HotHealth, it would just be a one-on-one consultation. But keep an eye out over the next week or so, and those features will be available for everyone to use. So I often get asked, is HotHealth a client record system? Where can I take my client notes if I'm having my video consult online? And I guess the answer, HotHealth is not a client record system. It's not really built to be for client management. It's more built for an engagement platform between your organization and your clients and patients. So there are lots of tools out there for people who don't already use online or client records in general. Global Health has a product called Mastercare Plus. It's web-based. You can access it anywhere on any device. It's scalable because there's no installation required. So as your business grows or changes, you can add licenses as you need it, but no installation or specific hardware is needed on your computer. All you need is a web browser. So we have different packages available. So allied health for things like appointments, Medicare billing, and client records, outcome measures, and things like that. Then we have one for secure messaging, which is really just client notes and referral net integration. So opening the door to send and receive secure messages and also take some client notes as well. Recently, we've released the clinical prescribing, so that allows prescribing to happen in the platform via MIMS integration. And then for enterprise level businesses, we have referral management and discharge summaries. So I'll just quickly show you how that looks, and I'll also show you the inbound HotHealth form that we filled out. So I've just jumped into Mastercare Plus, which is my login. Here you can see that there's a client dashboard, client details, clinical documents, so that will include any inbound form that comes in, and then alerts, diagnoses, and things like that. So this is the allied health version. If I go up to messaging and go to inbox, this will show me all the inbound messages that my team has received. And I can see here that 10 minutes ago, a form was received for Miss Lisa Peter. If I click process, it will do a search in the back end to see if it matches any client record that already exists. So it does here. It's saying the details in this based off the first name, last name, date of birth matches a Lisa already in my system, and I can just attach that form to that patient. So depending on the clinical system you use, this process might be a little bit different. But ultimately, once that's done, that's now saved against Lisa's file. And if I go back to her profile, I'll be able to see it in her clinical documents here. So the integration between HotHealth forms and ReferralNet allows that more smooth approach to getting the information from one system to another. The next thing, one of the final things I'll touch on today is we've had also a few questions around, now that I'm working from home or have to work from home more often, I don't have access to a fax machine. How can I get around that? So from a digital standpoint, the fax machine's old anyway. But now that people are not in a clinic so much, people have had to really look into an alternative fast. Unfortunately, email is not the securest way of exchanging health information. So secure message delivery is a really great option for those people. As I mentioned at the start, ReferralNet can be integrated with most practice management systems. In this screenshot, it's Mastercare Plus. And it also means that you can receive those forms directly to the practice management or clinical system if you need to. So how might HotHealth look with your current workflow? So for businesses that don't have a website, HotHealth can kind of be there from the start. So they can kind of be there from this first part when a patient is searching for a health service or organisation online. If you do already have a website that's working great for you, then that's fine. HotHealth might step in at the next step where the patient books online, and then that booking might be sent to an integrated system. Again, if you're already using an online booking system and it's working for you, that's fine. Those first two steps can happen by existing processes, and then HotHealth can kind of fill in the gaps where you don't have something already. So the next bit would be where the patient is sent a link to a form to be completed. That can be filled out via web browser, and all you have to do is distribute that link, whether that be via email, via SMS, or as I said, whether it's something like a QR code that is used when they actually get to the clinic. That form's then completed and sent by ReferralNet and attached to your practice management system. The appointment occurs in person, or if it's online, then HotHealth can facilitate that as well via the teleconsults ability. And then after the appointment, the patient knows that they can visit that online portal for other information that they need, maybe to see upcoming appointments if you're using that part, to fill out other forms such as patient satisfaction, or maybe they need to do some questionnaires in the meantime so that, you know, the clinician can keep a track of how they're going when they're away from the platform. So that's kind of how HotHealth fits into the workflow of an appointment being made to after the appointment. So to wrap up, HotHealth can be all of these things, or it can be some of these things depending on what your organisation needs. So it can be a website. If you've already got a website, that's great. It can be in parallel to your website. It can be used for video consultations, online bookings for patients. For some smaller guys as well, they're just using HotHealth to manage their own appointment book. It has digital forms, user and group engagement, so back to that event and news article features. Online payments, I didn't touch on this today, but HotHealth is integrated with Stripe, which means you can connect your Stripe account to HotHealth, and that will allow you to A, sell things in the online store on HotHealth, but B, it can also allow you to take payments for bookings up front. So if you're not integrated to a practice management system, you're just using HotHealth standalone, you can charge people when at the time of booking the appointment. It's your branding so that it fits into that consistent brand presence online. It's got events, news, staff profiles, where for video consultation and in-person bookings, you can put in what specialities they're available for, what times they're available for booking, and that kind of information. And HotHealth also gives you really easy back-end access for organisations. So we've tried to make it easy from a configuration and customization point of view, but also easy to upload news and events and things like that, because the more you use HotHealth or a tool like HotHealth to engage with your patients, the better outcomes that there are going to be. Of course, the HotHealth team's always available to help out with different things as well, but we do try to encourage people to get to know the back end as well as they can. So that's it for me for today. If anyone's got any questions, feel free to get in contact.